I'm Alice. Welcome back to Men Health 30, where we don't shy away from the truths about men's health, especially sexual health. Today, I'm going to talk about something that most men do, but very few are willing to speak about. A habit that seems harmless, very personal. It happens within a few minutes after you release. But it's precisely in that moment that you may be opening the door to a silent condition that can last for years. I'm talking about hygiene after masturbation. It sounds simple, but if you skip it or do it the wrong way, that could be the fastest route to prostatitis, a condition that affects more than 50% of men over the age of 50, with symptoms like frequent urination, pelvic pain, and declining sexual function. Even worse, there are chronic cases that go on for years without anyone knowing the real cause, until a doctor traces it back to this small, overlooked habit. Prostatitis is not something unfamiliar. But the scary part is this: most men don't even realize when they've already stepped into the danger zone. Prostatitis doesn't just come in one form. In fact, it's divided into two types, and both can start from something seemingly insignificant: improper hygiene after masturbation. The first type is bacterial prostatitis. This is the acute form, with symptoms like high fever, painful urination, frequent urination, and pain during ejaculation. The cause? Very common: bacteria from your hands, from the anus, or from the surrounding environment entering the urinary tract, especially when you don't clean yourself properly after masturbation. The second type is even more dangerous because it's silent. It's non-bacterial, but causes chronic pelvic pain that can last for months, sometimes even years. No fever, no clear signs of inflammation, but the discomfort lingers, vague, persistent, and exhausting, leaving many men in a constant state of anxiety about their sexual function and quality of life. According to statistics from the U.S. National Institutes of Health, NIH, up to 50% of men over the age of 50 will experience at least one episode of prostatitis in their lifetime. And the ironic part? Many of those cases stem from a cause no one suspects, but that's been repeated over and over for years: poor hygiene after masturbation. A habit that seems like nothing is actually a wide-open door for bacteria and inflammation to invade the male reproductive system, leading to long-term consequences, sometimes irreversible if not caught early. Most men think, once it's done, it's done. But that's not true. The moment right after masturbation, if you don't clean up properly, is exactly when bacteria begin to attack your body. So, what actually happens when you finish and skip proper hygiene? Dried semen on the skin? That's not just a stain. It creates a moist environment that's perfect for bacteria to grow, especially around the foreskin and in skin folds. Dirty hands or long fingernails. You've just built a bridge for bacteria from the outside world to travel straight into your urethra, a very sensitive and vulnerable area. Not urinating after ejaculation? You leave bacteria sitting in the urinary tract, and they can silently march upstream to your prostate, using old towels or wiping from back to front. That's how bacteria from the anus get transferred directly to your genitals, significantly raising the risk of infection. And this isn't just speculation. A study published by the Mayo Clinic showed, within just 30 minutes, 42% of men who didn't wash their genitals after masturbation had E. coli bacteria detected around the glans penis, a common intestinal bacterium that, when misplaced in the urinary system, can become a silent threat to the prostate. If you've recently started noticing signs like burning sensation when urinating, frequent urination, or having to wake up 2 to 3 times a night just to go to the bathroom, a dull ache between your anus and testicles, or in your lower abdomen for no clear reason, ejaculation that feels slightly painful or causes a burning sensation, or worse, you feel drained, exhausted, and lose your sex drive after just one time masturbating, then this isn't just about getting older or a tiring day. It's your body speaking to you, and you need to listen. Prostatitis is not just a pain. It's a chain reaction, slow, silent, and persistent, that affects your quality of life, your sleep, your sexual health, and even your emotional well-being. You start avoiding intimacy out of fear of pain. You sleep poorly because you wake up multiple times to urinate. You slowly lose energy, confidence, and then you begin to doubt yourself. And the scariest part isn't the pain. It's the feeling of losing control. And all of that could start from one seemingly harmless habit you've repeated for years: not cleaning yourself properly after masturbation. So what should you do after every time you relieve yourself to protect your health? Here are 5 simple but crucial principles, things no one ever teaches you, yet they can help you avoid infections, discomfort, and unwanted visits to the urologist. 1. Wash your hands, both before and after masturbation. It may sound simple, but your hands are the main carriers of bacteria from the environment into your urethra. Washing your hands thoroughly can reduce the risk of genital infections by up to 90%, according to multiple microbiological studies. Don't let dirty hands ruin your reproductive health. 2. Clean your genitals with warm water and mild soap. If you let semen dry on your skin after ejaculation, you've just created a perfect breeding ground for bacteria. A quick wipe isn't enough. Use warm water and a non-irritating soap to properly clean around the glands and under the foreskin. This is a simple yet powerful step to prevent infection at its source. 3. Urinate right after ejaculation. It might seem random, but this is actually one of the body's natural defense mechanisms. Urinating helps flush bacteria out of the urethra, preventing them from traveling up toward the prostate. A step that takes less than 30 seconds, but offers real protection. 4. Change into clean underwear. Choose breathable cotton. After masturbation, sweat and leftover fluids can build up. If you keep wearing damp, tight, or non-breathable underwear, you're creating the perfect conditions for bacteria to multiply and invade. Clean, dry, breathable cotton is your best friend if you want to keep your manhood protected. Small blue diamond 5. Practice moderation. Don't overdo it or follow impulse too often. Even with proper hygiene, over-masturbation can leave you fatigued, lower your energy, and increase your risk of chronic inflammation. For middle-aged men, 2 to 3 times per week is a healthy, balanced frequency, both for your physical and mental well-being. Don't treat this as just a cleaning routine. See it as a treatment ritual to protect your long-term male health. Because skipping even one of these steps could cost you months of recovery, or even your confidence as a man. We've just gone through a topic that many people consider no big deal. But in reality, it has a profound impact on men's sexual health, confidence, and overall quality of life. From seemingly harmless mistakes to simple but rarely discussed principles, you now hold in your hands the kind of knowledge that every man should have learned much earlier. If you found this video meaningful, please share it with a man you care about, because sometimes just one timely piece of information can save someone from years of exhaustion and regret. And if you'd like to keep following honest, straightforward conversations about middle-aged men's health, don't forget to like this video, leave a comment below, and subscribe to Men Health 30. We're always here to listen, to share, and to stand by your side, like a trusted companion on your health journey. In the next video, you'll learn how to detect if your testosterone levels are declining, even without a lab test. See you there.